And here's what's happening at 5. I'm Jeff Gianola.
And I'm Jenny Hansen in for Elizabeth Den. 4,000 healthcare workers in Oregon and Southwest Washington off the job starting today as a 3-day strike against Kaiser Permanente begins here and around the country.
This strike is over wages and what workers' unions say is staffing shortages. Lisa Balick live in Clackamas with where negotiations stand now. Lisa?
Yeah, well, right now there are picketers. They've been out here all day since 6 in this morning at Kaiser Sunnyside. Also, all Kaiser locations in Oregon and Southwest Washington. But we want to remind people that the hospitals, including the emergency rooms, are open, and we have seen people come and go all day. No one's been blocking their access. But as far as the bargaining, well, that went on overnight, but it was over as soon as the picket lines went up.
Patient care!
Before sunrise, hundreds of striking Kaiser Permanente workers were on the picket lines outside hospitals and clinics in Oregon and Southwest Washington, joining tens of thousands of Kaiser workers in 5 states on round-the-clock shifts for 3 days.
Patient care! We are part of the largest healthcare workers strike that has ever happened in this country.
They're demanding better pay and more staff to help with patient workloads.
If we had more staff on board, we'd be able to get more patients in through the doors and then out in a safer way. And it's not just nursing, it's also our lab, it's our pharmacy, it's everybody that's kind of just struggling with staffing wise. And then that just puts a delay on patient care every time.
About 4,000 union members at Kaiser in Oregon and Southwest Washington are on strike. Technicians, nursing assistants, home health aides. Kaiser brought in temporary workers and tells us some non-emergency and elective services are being rescheduled. If you have a doctor's appointment, Kaiser says you'll be contacted if there's a change. Kaiser management won't go on camera, but told us the strike should not keep anyone from seeking care. Hospitals, including emergency rooms, are open. As of the last update, the union wants a $25 an hour minimum wage. Kaiser offering $23. But hiring more staff is a must, say strikers. I talked to an employee who answers mental health and addiction calls.
Just the other day, one of my coworkers was dealing with a patient that was having a crisis, and they had a gun to their head, like literally had a gun to their head, and she had to work through that call and immediately compose herself to handle the next call because we were short-staffed.
Now, again, staffing issues, pay, big issues here. Also, the pharmacy techs are out on strike. Their strike started on Sunday. That one to last for 3 weeks. But again, pharmacies, some of them are being open at the hospitals, at the urgent cares. Also, there's partnerships that Kaiser says it has with community partners like Fred Meyer. But again, if you are looking for a prescription, start with Kaiser first to see what they can do for you. As far as the strike here, it is going to go until early Saturday morning, and we understand from Kaiser, from the union, that there will be no talks underway while the strike is going on. Live in Clackamas, Lisa Balick, KOIN 6 News.
And thank you, Lisa. That strike also affecting Kaiser Permanente facilities in California, Washington, Virginia, Colorado, and Washington, D.C. Vocational nurses, x-ray and lab technicians, and surgical, pharmacy, and emergency department employees all among those off the job. Dozens were on the picket lines today in Los Angeles.
Having to juggle numerous patients at the same time, that increases patient wait time, puts doctors behind, puts patients behind. They don't get a chance to get the care that they actually need.
We will continue to follow the 3-day strike as it continues, and of course we'll let you know when a deal is reached.
Started off with